are talking about breast cancer. And we have, again, Dr. Danielle with us. Welcome back.
Thank you.
Doctor, let's get started. What exactly is breast cancer?
So breast cancer is a disease where the cells in the breast abnormally replicate.
And for our last conversation, it was on cervical cancer, and that was something that specifically affected women. But breast cancer, if I'm correct, does affect both genders.
It can affect both men and women. For men, it really accounts for less than 1% of those diagnosed with breast cancer. So largely it's a disease for mostly women, but it can affect men. Yes.
Okay, yeah, because I did remember reading that somewhere and being a little surprised. Because I thought it was something that only affected women, but it's good to know. So what are the risk factors for developing breast cancer?
So there are several. The first one I would say is increase in age, right? So the older you get, the more your risk increases. Woman is a risk because we said that it affects women more, right? Also, again, just like lifestyle factors can contribute. So women who are more obese tend to have a higher risk as well. A history of breast disease, like a personal history of breast disease, can be a risk for breast cancer in the future, right? Also, family history of breast cancer can play a role. There is a genetic component as well to some breast cancers, so genetics would be a risk factor as well.
Okay, so if it's something that runs in your family, it's something that you should be proactive about and getting checkups on. So how is breast cancer diagnosed?
Our screening tool for breast cancer is a mammogram, right? And it is recommended that women start getting screened with mammograms at age 50. Normally, we'll do it every 2 years for the average healthy woman. If there's a strong family history of breast cancer, or if there are like other symptoms that would be suggestive of breast cancer, then we'd want to do some of those testing much sooner. Now, once a mammogram is done, if there's any abnormalities that is found, then we'd want to do a biopsy. So the biopsy is the definitive way to diagnose breast cancer.
So if I understand correctly, you said that usually if the screening only starts after 50?
At age 50.
At age 50?
Yeah.
But unless there's like some family history or whatnot, then it could start sooner.
Right. So if there's a family history, so say, for example, there was a strong family history of breast cancer at even say like 45, then we'd want to start the screening sometimes even 10 years before the first family member is diagnosed. Because the purpose of the screening test is to catch things very early before we start having symptoms.
So does that mean a younger person cannot get breast cancer?
It doesn't mean that they cannot. You will have young women having breast cancer. It's a smaller percentage compared to like older women, right? And that is why it's so important for women to stay connected with their healthcare provider, their family physician, nurse practitioner. Doing self-breast exams can also help, and just checking in if there's any concerns or changes, because I have diagnosed patients who are like age 30 with breast cancer as well. Even though it's not common, it's still possible.
Okay. So thank you for that. We talked about how it's diagnosed. How is breast cancer treated once you've received the diagnosis?
So many different ways to treat it. So, sometimes surgery is involved. There could be radiation therapy, chemotherapy. Also, there's hormonal therapy as well. And then also just looking at the patient as a whole person, like we want to do everything that we can to reduce risk factors as well, right? So looking at lifestyle changes, asking patients to, make sure their diet is good, they're staying healthy in other ways that can definitely help with the treatment. Yeah.
Yeah, I know you touched on it. I was going to ask you how can we prevent it and reduce the factors, but you spoke on it. Is there anything else that you'd like to add?
Yeah, so we touched on the lifestyle modifications to reduce risk. Other things that could be helpful is even like breastfeeding. Like breastfeeding has been shown to reduce the risk of breast cancer as well.
Oh, wow. Okay. I didn't know that.
Yeah. And then, there's definitely other like specific things that can be done for patients who have a strong family history or a strong genetic component. So like we have the BRCA1 and 2 gene. For patients who have a strong family history or even a personal history of that, I would say, talk to your physician about other options as well.
Okay. What are the potential complications of breast cancer if not properly treated?
So if not treated, then, patients run the risk of the cancer spreading, right? So sometimes it could just start off in one breast. But then if there's no treatment, that tumor just gets bigger, invades more of the breast tissue, could start affecting the chest wall, could start affecting lymph nodes, other organs in the body, right? And ultimately could lead to death.
Okay. So for the viewers watching, is there resources and supports that are available for dealing with breast cancer, the diagnosis, coping with it, those kind of things?
Absolutely. So, the majority of the community health centers may have resources. So pamphlets, brochures. Again, there's also the primary providers. They're going to be a very useful resource to get factual information about breast cancer. They can also teach women how to do a self-breast exam, right? And also provide information about when to get screened. And I would probably say too, especially for Black women, it's very important. So I'd spoken about cervical cancer before and, how it disproportionately affects Blacks. The same for breast cancer. So we find that a Black woman is more likely to die from breast cancer than a white woman, right? There's some statistics that show even as high as like 40% more likely to die, right? And again, it's some of these other factors, right? Like access to care, access to information, that we need to combat. So I'm really happy that we're having this talk where we can get information out to women to say, breast cancer is preventable, right? We want to screen with a mammogram. We want to make sure that we're detecting any forms of cancer abnormalities early, so treatment can be started.
No, thank you so much for all of the information you shared. Like you said, this is an important thing that we're doing, building the awareness in our community about these chronic diseases, and that's why we're doing this and doing this campaign. So, thank you so much for speaking on the subjects that you've spoken on and welcoming us into your clinic, which is so beautiful. And yeah, guys, that's another segment. Thank you guys for tuning in. My name is Billa, and this is a public awareness campaign on chronic disease and Black health brought to you by Tebu Community Health Center. Thank you.
My name is Ruqiyya Warsami. I have been a settlement counselor at Somali Center for 22 years now. I am somewhat aware of what's happening within our community. I've known a number of women who have had both cancers. Some of them passed away from it. I think one of the reasons could be perhaps the lack of medical history. Many of us, our parents and grandparents passed away, but we don't know what they were passed away from. So, for example, if somebody were, for example, many times I was asked family medical history, but I have nothing. It's blank. I don't know what my father was passed away from. I don't know what my mother passed away from. And those conditions might have affected us before, but we didn't know. We weren't aware of that. So nobody was talking about it. And a lot of people believe that something that just became an issue for us here, where there is the possibility that it was it always existed, but we didn't know. So there was no like prior information. There was no like ways of preventing it. We have to be proactive. We have to use what is available. I know a lot of women in their 50s and maybe even 60s who have been here for close to 30 years that don't go for cancer screening at all, whether it's breast, whether it's cervical, whether it is colon cancer, it doesn't matter. They receive almost every month, the papers are coming to their addresses, but they are not responding. So I think that would have been help because unless you know what's going on with your body, you're not going to find any solution. They might be feeling something, but they're not going to have it investigated. A lot of women are not. I know a lot of women, a lot of childbearing Somali women who never had a pap test, who never had a breast screening. Unless we use the tools that are available, these conditions are going to keep killing us.